Here we have AP view of both hands. This is right hand, this is the left hand. In 50-year-old with history of pain in the fingers bilaterally, they want to look for is there any evidence of inflammatory arthritis. So what we see here on these radiographs is abnormality in the distal interphalangeal joints. So how to describe these abnormalities and how to interpret them? So first, the radiological description. There is significant loss of the joint spaces of the distal interphalangeal joints of the second, third, fourth, and to some extent fifth digits of the right hand, and second, third, and fifth digits of the left hand, with central depression and subarticular sclerosis in the bases of the distal phalanges. The proximal interphalangeal joints, the MCP joints, the CMC joints, the intercarpal joints, the radiocarpal joint, and the distal radioulnar joint appear unremarkable on both sides. There is no soft tissue swelling, no soft tissue calcification. So this is the radiological description. So let me magnify the distal interphalangeal joints to show the central depression and subarticular sclerosis. You can see it nicely, the central depression and subarticular sclerosis. So how to interpret it? Based on these features, findings are consistent with osteoarthritis of the distal interphalangeal joint. So these are not features of erosive arthritis or inflammatory arthritis. The findings are very characteristics for osteoarthritis of the distal interphalangeal joint.